Hello, welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about how to fix a tight upper back. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. All of us have experienced upper back pain throughout our lives. With the rapid spread of technology, all of us are using computers, smartphones, and laptops all the time, and having a good posture while using these kinds of stuff is not that common, and it ends in many health issues and pains for us. One of the most common types of these pains that are mostly caused by poor posture is upper back pain. If you are curious about how you can fix your posture, we have lots of videos on our channel you can check out too. So, let's back to this video. In today's video, we are going to be sharing with you 7 exercises and stretches that help to fix the tight upper back. These exercises are very simple and you can do them everywhere, and no special equipment is required. So, stick around to the end. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Be sure to do these exercises at least 5 times per week to relieve upper back pain. These won't take you more than 10 minutes, but you will see the result very quickly. While you are doing these exercises, focus on relaxing your body, and please notice to release any tension in your spine and anywhere else you feel tightness. Do these stretches only to the degree that feels comfortable for you. Do not push yourself beyond your limits, and discontinue any exercises that give you beyond mild discomfort and pain. Number 7. CatCow Stretch. This stretch focuses on both upper body and lower body muscles. You can do it not only in the morning but also at the end of the day to relax your muscles and joints. To do this exercise, you should get down on all fours pose. Flat your back. Then you should round your spine and arch the back, drop the chin to chest. Gently contract your abdominals as you do this, taking care not to hold your breath. Hold for 5 seconds, relax and repeat. Do a total of 5 arches. Number 6. Child pose. Child pose is best known for its impact on tension relief. It not only stretches your back, your neck, and your hips, but also releases tensions in your chest, spine, and shoulders, which leads you to have a relaxed and flexible body. Allowing the forehead to rest on the ground has an effective impact on your blood flow, which helps increase your muscle power. Child pose has some variations. No matter which one you have chosen, all of them have these benefits. We will give you instructions for the most used one. Come to your mat, make your knees as wide as your mat, bend until your belly is between your thighs, and your forehead is on the ground. Place your arms straight forward on the side of your head with the palms facing the mat. Notice that there shouldn't be any pressure on your neck. Keep your neck normal and neutral. Number 5. Chest expansion. This exercise has many different types, and all types will work on your shoulders. It will make your shoulders muscles stronger and more flexible. It also promotes the range of motion in the shoulders. You can do this exercise while you are standing, and holding a Pilates band behind your back with both hands. Stretch the band, and lift your chin up and look toward the ceiling. Hold the pose for 30 seconds each set, and having 3-5 sets is enough per day. You can also do this exercise at the gym with gym equipment. There is another type of this exercise that is helpful to shoulder pain. For doing it, you should bring your hands up to your shoulders, and shape little circles with your hands. Do it slowly with concentration and focus. Number 4. Shoulder circle. This exercise aids to enhance your arms' range of motion and fixes the joints for elevating heavy objects. It also makes a great dynamic stretch before a workout and throughout the day to ease muscle tension. To do shoulder circles, raise your shoulders overhead, shoulder distance apart, with your fingers facing up toward the ceiling. Swing your arms forward and then rotate them back to your sides. This is 1 rep. Number 3. Arm across the chest. To perform this exercise, start by standing straight with feet pointing straight forward. Take your left arm across your chest. With the right hand, grasp the back part of the left upper arm just above the elbow. Using your right arm, slightly pull the left arm across the body. Keep the left elbow bent as you pull across the body. Hold this stretch for 30 seconds. Switch sides and repeat. Perform 2 sets on each side. This stretch loosens the muscles of the chest, improves blood circulation, and prevents neck and back pain. This stretch also helps to open up the chest and align the shoulder blades, improving posture and increasing flexibility. Number 2. Pendulum. This works on your deltoids, supraspinatus, infraspinatus, and subscapularis muscles. In this exercise, you need to lean forward and place one hand on the table for support and let your other arm hang freely at your side. Gently swing your arm backward and forward and repeat the exercise, moving your arm side to side and then in a circular motion. Repeat the entire sequence with your other arm. You should ideally look at performing 2 sets of 10, 4 to 5 times a week. Number 1. Overhead arm reach. Sit in a chair, facing forward with your feet on the ground. Extend your right arm up above your head and reach to the left. Bend your torso until you feel the stretch in your right lat and shoulder. Return to start. Repeat 5 times, then do the same thing with your left arm. If your tight upper back muscle is the result of a trauma, or if the pain has persisted beyond 2 to 3 weeks, you may want to seek medical attention. Certain causes of upper back pain, such as rotator cuff injuries and frozen shoulders, get worse over time and may require surgical intervention if more conservative treatments are unsuccessful. If you don't feel your pain warrants a visit to the doctor, you should consider enlisting a physical therapist to help. You don't need a referral to do this. After an initial evaluation and assessment of the pain, your physical therapist may use a goniometer to measure your range of motion and strength while monitoring the quality of the shoulder motion. Your physical therapist will then likely recommend stretches and exercises to help control inflammation and relieve pain. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.